Hi, my name is Dr. David Weinstein. My partner at the Sunrise Wellness Center is Dr. Ronald Sinagra. Together we have put together a formula that can help patients with peripheral neuropathy and restless leg syndrome. And I'd like to talk about both those subjects today. The first thing to understand is that we have a neurologic metabolic approach to health. Neurologic meaning that we look at the nervous system, your spine and peripheral nerves, to see how they are functioning. Often with peripheral neuropathy in particular, we have to look at those lower back discs if it's in your leg, or your cervical discs if it's in your arms, to make sure that you're not having spinal stenosis, nerve entrapment, so forth and so on. It could even be a simple pinched nerve. Secondly, we have to look at you metabolically. What I mean by that is that a lot of the peripheral neuropathy patients we see have problems with either diabetes and autoimmune conditions such as either rheumatoid arthritis, lupus, sarcoidosis. Some of our patients actually have mineral deficiencies, B6, B12. With peripheral neuropathy in particular, we can see patients that have hypothyroid conditions or even infections. How we find out which problem is yours is by looking at you again, neurologically and metabolically. Now, neurologically, we look at x-rays, MRIs, do neurologic exams. Metabolically, we do lab work. So we have you fill out a complete history based on the systems in our body to see how you're functioning, and then we run specific lab work. A little bit more in detail lab work than you probably have gotten before, looking for things like food allergies, blood sugar, infections, gut problems or digestive problems, immune system problems, to see if you have an autoimmune condition, what is tripping your immune system. For instance, let's say you're eating a food you're allergic to and your immune system is going crazy and you have the genetic code for rheumatoid or lupus or one of these autoimmune conditions. As opposed to trying to treat the disease, we try and figure out what's making your immune system go crazy and fix that. The triggers can be your immune system, food allergy, it could be something in your gut, it could be systemic inflammation due to either leaky gut or some type of problem with your digestive system, parasites, infections, chemical toxins, so forth and so on. With restless leg syndrome, although by dictionary they tell us it's an idiopathic disease, meaning they don't understand why it happens, we understand that it's often related to mineral deficiencies with either vitamin B, zinc, magnesium. It could be problems with iron, with dopamine, something called the Willis-Ekbom disease, which is an associated combination of iron and dopamine problems. You could have side effects from medications. Anti-dopamine agonists can cause restless syndrome. Antihistamines, antidepressants, antipsychotics can sometimes cause restless leg syndrome, as well can spinal stenosis, as we mentioned before. So for us to help a patient with peripheral neuropathy or restless leg syndrome, the first thing that needs to be done is a detailed case history. We have to know what's going on with you. Secondly, we have to look at you neurologically and metabolically. Metabolically, by looking at the systems in your body through lab work. So when the patients come to see us, they normally bring in whatever current lab work they have, and we send out for additional lab work. We often take x-rays of your spine. Sometimes MRIs are necessary as well. Once we know if it's a neurologic problem or a metabolic problem, how we treat you or how we try and get you well, we don't really like the word treat, how we try and make your body function better is by metabolically putting you on a dietary program that'll help your body function and be healthier. Secondly, we supplement the areas of your body that aren't working well. In other words, let's say your problem is coming from a zinc deficiency, then obviously we would supplement zinc. If your problem is coming from something like hyper or hypoglycemia or blood sugar problem, we would try and address those issues. If your issues are coming from some type of food allergy affecting the lining of your gut, of course we would try and help you heal the lining of your gut and change, again, the way you're eating. There is a way to get well from these kind of conditions, but first you have to know, is it a neurologic problem or a metabolic problem? If it's a metabolic problem, what type of metabolic problem? And then we can attack it naturally and get you well. If you go to our testimonial page, you'll see many patients who have come to us for a variety of reasons, and it seems like patients with restless leg syndrome and peripheral neuropathy have multiple problems, multiple system breakdowns. They're usually coming to us for another problem, and as we start to help those problems and their body starts to heal, they get better. And you could be better too. What we offer in our office is a free consultation, because without meeting you, without knowing you, I don't know, one, if we can help you, and two, if we can accept your case. So I'd like you to call our office if you're interested, if this resonates with you and you're looking for a different path to health, and I'd like to discuss this with you in detail and see if we can help. Thank you.